This is going to be a different kind of video. I'm going to be talking about my 2014 battle with cancer. Just something I feel like I need to share, to get off my chest, and maybe it'll help out somebody else that's out there that's maybe going through the same thing. So, I'm going to start from the beginning and try to go through all the details as best as I can remember. I do have some memory issues related to the chemotherapy. Sometimes, 5-6 years later, things still come to me that I didn't remember previously. So I'm going to try to recall as much as I can. A lot of 2014 was a blur. So, I'm going to start from the very beginning. I started having a pain in my abdomen, right in here, right to the left of my belly button. Started hurting really bad, like unable to function bad. Really sharp pains. I didn't know at the time it was my kidney. So right at my kidney, really sharp, just explosive pain. I ignored it, as a lot of people do, for a very long time. I just walked around with it. I was taking Tylenol by the bottle, just swallowing bottle after bottle of Tylenol, different pain medications, trying to get it under control. Finally, I made the wise decision to go to the doctor, and initially they said it was a pulled muscle. They gave me some prescription pain medication, which did absolutely nothing. So it got to the point, the pain in my left kidney got so severe that I was having trouble walking. So that was a big red flag. And then I lost my appetite. I couldn't eat. And when I did eat, I vomited. It's pretty bad. I had some extremely significant weight loss, which I've been overweight for a while. On and off, my weight fluctuates greatly, but I did start losing a lot of weight really quickly. So I went to the doctor, said I couldn't eat, couldn't function, and again, they didn't really do anything. And one day, I was at work. It was around the holidays. I'm not sure exactly when in 2014, but the pain in my left side got so bad that my left leg stopped working. So I left work. I didn't want to. I went to an urgent care place, and right off the bat, the doctor said, "This sounds like testicular cancer." And I said, "That doesn't make any sense. I'm not having any symptoms with my testicles. No, nothing at all. Just a pain in my left side." He said, "Sounds like testicular cancer, so we need to get you an emergency full body scan." So I waited. It was a big hassle, but I got the CAT scan that day, and sure enough, that doctor, he said, "Yeah, it's testicular cancer." And I could not believe my ears. What in the world? My kidney hurts a little bit. Why is that testicular cancer? So he explained. He said there was an extremely large mass sitting on top of my kidney, and he said the first thing that we do is remove the testicle and start chemotherapy. Now, neither one of those things sounded like anything I wanted any part of. I immediately started saying, "Hey, can't we do something else? Can't we just remove the tumor from my abdomen? Can't we just do that? Can't we please just do that? Please don't remove a testicle. Don't start chemotherapy. That's horrible. That's torture. It's just awful. I can't imagine." So I started calling family members. I called my dad, called my grandmother, and I was like, "Hey, I got this crazy bad news." Things started rolling really quickly, and the doctor set me up with an oncologist, a urologist, and started doing tests. The first medical procedure that I had after the CAT scan was a, what do you call it, a biopsy of the tumor. So I had to go in, it was an outpatient thing, and they basically stuck a giant needle through my back into the tumor. And yes, it was in fact testicular cancer that had spread into my abdomen and was crushing my left kidney. So I got a urologist, I got a whole bunch of doctors where I'd never been to the doctor in my life. Now I suddenly had 20 different doctors I was talking to, mainly a urologist and an oncologist. And I finally did away with all these doctor's care, urgent care guys, as they set me up with a really great oncologist, really great urologist, and the uncomfortable and sometimes extremely painful stuff began. So the biopsy came back, it was testicular cancer. They explained to me that when someone has had testicular cancer for a very long time, the tumor will eventually grow too large to be in the testes, and it moves into your abdomen, and from there it will spread to your lungs and brain, and that's what happens with this type of cancer. And unfortunately for me, cancer runs in my family. Testicular cancer is not hereditary, or that is what they told me. They said they're unsure why guys get it. Just some guys get it, some guys don't. It's unclear exactly where it comes from, how it starts. And I asked, because it sounded pretty severe, the way the doctors were talking and the speed at which things were happening, I asked them, I said, what stage am I in? And they said, don't let it scare you. You are in final stage. You are in last stage testicular cancer. I don't remember the numbers. I do know they said that testicular cancer does not have as many stages as other cancers. So even being as far advanced as it can be, testicular cancer can be treated. So that's good in a way, but it did scare me. It scared me that I had cancer, period. You don't want to hear that. You don't ever want to hear that. But they said, listen, testicular cancer is very treatable. It's one of the more treatable kinds. So the first thing was going to get the one testicle removed, the testicle that it started in. And that was extremely scary. If you're a guy, you can imagine going to get one of them removed is not something that you ever want to go through. So it was an outpatient thing, but it was my first surgery. So you go to the hospital, they put you under, and you wake up, you're bandaged up. They essentially cut you around your waist area and suck it out, is how they described it to me. That surgery was emotionally devastating. Physically, I was sore, and it did take me about, I'd say a little over a year to get used to living with only one. I did try to do, later on in the process, I did try to do sperm banking because we were doing a lot of procedures, the removal of the testicle, the chemotherapy, and some other surgeries. I did try to do some sperm banking, and during chemotherapy it was not successful. The sperm was ruined from the chemo. And then later on, we tried to do it again in a different kind of sperm banking, and it didn't work that time. So I was pretty much sure that I was infertile just from the chemo alone, possibly removing the testicle, possibly from the chemo, combination of the two. We'll get into a little bit of that later. So removed the testicle, and that was devastating. Still in this excruciating pain from this tumor on my kidney. That's my immediate concern, right? I'm in devastating pain. I can't function. My left leg doesn't work, and I can't eat, can't sleep. I'm just in pain all the time. And unfortunately, the bad news is the only thing that is going to stop this pain from my kidney being crushed is going to be starting chemotherapy, which is going to be extremely, extremely bad. So I was 28 when this happened. I was 28 when I was diagnosed. And they said, because you're in your 20s, you don't have any other health issues that we know about, we're going to blast you with the maximum amount of chemotherapy possible. So it's going to be bad. It's going to be rough, but we're going to do that so it doesn't come back. Again, I had seen other people in my life go through chemo. I did not want to do it. I even talked to the doctors, maybe just is there something else we can do? And they said there really isn't. They said, unfortunately, you got chemotherapy is it. When you're diagnosed with cancer, it's chemotherapy or death. And I asked about removing the tumor, and it was just simply too large to remove from my abdomen. So that option was out the window. So I tried everything. I had every excuse for not going through this, but I had to go through it. Got a really great oncologist, and he had a team of people working with him. He assured me that there was like this massive team of doctors working with him on the case, and we started a combination of, I think, 3 different chemotherapies. Now, we were going to wait a little bit for me to start. Unfortunately, after having the testicle removed, I went home and I could not function. I was in horrible pain, and the vomiting got out of control. I couldn't drink water. I'd drink water and I would vomit for the rest of the day. I would try to eat food, I would vomit immediately. As soon as I took a bite, I'd vomit. So I was hospitalized due to dehydration, malnutrition, just couldn't take care of myself, essentially. So I was admitted to the hospital, and they went ahead and started my chemotherapy while I was in the hospital during that time. The oncologist came and visited me in the hospital, and we started it. They just rolled the chemo into the room, and I will never forget the first blast when they, like the second that it hooked to my arm, it just burned from, like you could feel your veins just boiling with this stuff. It felt like I was like 200 degrees, just burning up everywhere and nauseous, continual nauseousness. So we started the chemotherapy in the hospital. I was sent home. Now I had this idea, because I've seen such horrible things, I had this idea that you're supposed to be like almost incapacitated while doing chemotherapy, and I was wrong. I wish that I had thought, or that I could have been thinking more clearly, but I was wrong. So I let myself get really, really bad during chemotherapy. I didn't eat, I didn't drink, and I let the side effects get out of control. So this is a public service announcement. I'm getting emotional again. If you're doing chemotherapy, you're supposed to feel bad. You're supposed to feel tired. You're supposed to feel nauseous. You are not supposed to be laying in the floor wherever you're staying, screaming and crying and vomiting all over yourself. That's the condition that I was in. And I was too, like mentally, it was so confusing, and I was so not myself mentally that I wasn't even aware that I could call for help, or that I could go to the hospital or call the doctors. They would call and ask how I was doing, and I'd be like, I'm sick, and I didn't really explain, hey, I'm laying in the floor, I can't think straight, I can't see, I'm like just falling all over the place, just vomiting out of control. And sure enough, I would go to the next doctor's appointment, and they would, somebody, a coworker or a family member, my ex-wife helped me out a lot. They would drag me to the doctor's office. They would scoop me up and pour me into the doctor's office. And every time they took me, the doctor would be like, Chris, why did you not call us? Like, your blood work is terrible. Everything is bad. Like, you're dehydrated, you're malnutritioned. We're going to have to give you a plasma transfusion. We're going to have to do a blood transfusion. We're going to have to admit you to the hospital. And every time I did chemo, it was like this. I would go up there, and that's a really long process if you've never done chemo. You go to a room with a bunch of other cancer patients. They hook you up. They have to make your chemo after you get there, so there's a very long wait. You need to, if you are about to, I hope you're not, if you're about to do chemotherapy, take a laptop, a tablet, several books, maybe even 5 or 6 movies. You're going to be there for a while. Things might go wrong, and you might be there a day or two. The fastest that I did a round of chemo, I'm going to say maybe 4 or 5 hours. That was when it went smoothly. When I walked in, they got me checked in, and they weren't having issues with another patient or being overbooked, or the pharmacy, got the stuff real quick. So I'd say 4 or 5 hours was my shortest visit. My longest visit would be, I maybe waited 6 or 7 hours for them to make the chemo, get it to me, and then do 4 or 5 hours sitting there with it dripping into you. Finally, because my veins were getting just ruined from all the needle sticks of all these doctor's appointments, they told me that I was going to have to get a port put into my chest. I'll show you. And I'm not a fan of getting stuff put into my body. Right there, you can barely see it. I'm not a fan of getting stuff put into my body, but it was necessary so I wouldn't wreck my veins with all the chemotherapy. And that was one of the worst procedures I had as far as pain. I'm not trying to scare you guys. I'm just trying to tell you what I went through. Everybody's different. I feel like I really got messed up on chemotherapy, whereas a lot of people don't get as messed up as I did. I talk to other people, and they say, I was a little tired. Whereas I was laying in the floor screaming and just in horrible pain. So, to get the port put in, it was an outpatient surgery. I wanted to be put under, but they wouldn't do that. They told me they were going to give me something to help, but it didn't help. They strapped me to a table. I actually had some issues where I had to go to the bathroom after they strapped me in. Then they strapped me back in. It was a giant drill. And they put a giant drill right here through my chest. And it hurt. It felt like a drill going into my chest. And it went very deep. And it was really, really painful. Now the port, I ended up enjoying having the port. And I loved it. I wanted all doctors and nurses to use it whenever I went to the doctor. Unfortunately, you got to find that certain kind of nurse, certain kind of doctor. The ER will not use that. Another doctor's office won't use that. The urologist won't use that. I went to an esophageal specialist at one time. They won't use it. So that sucks, because you get this port and you're like, you don't get needles in the arm or the hands or the feet or the legs. I got bad veins, so they were sticking me everywhere. So the port is great when you're at the cancer center. When you go to other doctor's appointments, it's disappointing because they just won't use it. They can't access it. I think maybe a few times the ER was able to, but they had to track down that one nurse that's qualified to do it. So you get this little implant in here, and it's a lot better than getting stuck in the arm or wherever. It doesn't hurt. Getting a needle right here, it hurts, but nowhere near as bad as this. I cannot stand getting stuck here, and getting the needle right here in the chest, it was great. And they give you an ointment to numb it. I never used it, and it was very, very, it just feels like a little sting right there, and you're good to go. I did have issues with sometimes them getting it to work. I think mine was kind of turned in my chest a little bit, so they will have to tilt you back in the chair, get you to hiccup or say something really loud, stick the needle in while you're upside down, stand and sit, and turn sideways. They got a lot of different things. Finally, it started working. So that was a really unpleasant experience getting the port put in, but it was worth it. So doing chemotherapy, I believe I was doing 3 months. I was going to do 3 months of chemotherapy. I know I tried to have a positive attitude and say that's only a season. It was a rough butt season. Like I said, I really let it get out of hand, and I don't blame anybody that was helping take care of me, because nobody knows. It's different with every patient, and my dad didn't know. Nobody knew how bad of shape I was in. And then they take me to the doctor and admitted to the hospital again. I was doing a lot of my chemotherapy at the hospital, or they'd transfer me from the hospital to the chemo place and vice versa. It just took up all of my time. That's all I was doing, is sitting there being pumped with poison. And this is how the chemotherapy schedule kind of worked for me. And again, I don't know what chemicals were in mine. A lot of people know theirs by name. I don't. I was so out of it, had no idea. There was 3. And this is how it works. You go do chemotherapy, you feel pretty good. You go home, and about 3 or 4 days after you did your treatment, you start having some severe side effects. Your hair is falling out, your fingernails look awful, your mouth gets horrible sores inside of it. Every part of my body hurt. It just made everything hurt. The vomiting was the worst. I was vomiting before I started, so I think that may have been, it just piled on. That was one of my major, complications, was the vomiting was just constant. All day, every day. Couldn't eat, couldn't sleep, just vomit. It's gross, I know. I had a day, I actually had to move in with my dad because I was in such bad shape from the chemotherapy. I weigh over 200 pounds now. When I was doing chemotherapy, I weighed 130. So it's about 100 pounds difference from now to then. So I got down, I was a skeleton, essentially. And I was about 30 or 40 pounds underweight when I was doing chemo. The vomiting, I moved in with my dad. I'm trying not to skip around, but I got in bad shape for chemo. So I moved in with my dad temporarily. Me and my dog, Buddy, he's back here. You might see him snoozing on the couch. Yep, he's back there. You can see him a little bit. So moved in with my dad temporarily so he could help take care of me. Didn't want to, because I'm a very independent person, very private person. So I started staying with my dad. My aunt helped take care of me. My coworkers really helped out. Shout out to Home Depot. Everybody at work, my ex-wife, everybody was giving me rides. Everybody was helping out with gifts and get well stuff. They bought me a tablet, which kind of slipped my mind up until now. I had a really great support system, particularly my ex-wife. So, staying with my dad, the vomiting got out of control. I was throwing up, and I actually ripped my esophagus, and this was a pretty big deal. I'd almost forgot about it. I ripped my esophagus. I was throwing up blood. It was almost as if I was throwing up waste at one point. It was so bad. unbelievable, unimaginable. And I know it's gross, but this is just part of the whole thing was gross. It's testicular cancer, the whole thing. So vomiting from my nostrils out of my mouth. I mean, it was basically coming out of my eyeballs. It was so bad. I ripped my esophagus pretty severely, and I had to go to an esophageal doctor, whatever those are called. And they were talking about doing some stuff without anesthesia, and I flat out said no, 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 no. They were talking about running tubes down my throat while I was awake, and I said I can't do this, can't go through this. They told me one nurse said they weren't going to put me to sleep, one nurse said they were, and I was just flat out. I was like, I'm not letting you do it if you don't put me under. I cannot have my esophagus put together while I'm awake. Absolutely not. They ended up knocking me out, and actually, this is so weird. I actually enjoy being put to sleep for surgery. It's a very strange feeling. It's unlike sleep. It's unlike being unconscious. I like it. I don't know. I like being under anesthesia. Very weird, but hey, that's a positive note, right? So they put me to sleep. They fixed my throat, and I was having so many issues with the chemotherapy. I ended up me and my dad had like his entire kitchen table set up with pill bottles. I had so many prescriptions. It took me about an hour to take all the pills, and some of them you had to churn up. I was taking potassium, taking sleeping aids. I just couldn't sleep. I was taking all kinds of stuff, probably 30 to 40 plus prescriptions just to keep me together during chemotherapy. It was horrible. I was having a tough time swallowing them. A lot of times I'd sit there for an hour taking pills and then vomit them all back up. I didn't know whether to take them again, didn't know if I had vomited them all or what. I was all messed up. I remember one of my worst points during the chemotherapy was just crawling out to my dad's backyard and just laying face down in the dirt and praying that I would die. Because it hurt so bad. Just agony. Just keep in mind, this whole 3 months, my kidney was hurting. My kidney was squished. So the chemo seemed to be working. It was the tumor was shrinking, the tumor was shrinking, the tumor was shrinking. And I thought that this was going to be it. And that was sort of the plan with the doctors, is you're going to do, remove the testicle, do chemotherapy. Most guys are good with that. Unfortunately, it was such a low blow. It was almost as bad as hearing that the diagnosis of cancer. You have cancer. So I did 3 months of chemo. It was horrible. I read a lot of books. I burned my eyes out with laptop and tablet. And I read a lot of really awful books. I think the chemo actually made the books unenjoyable. I need to give those books another shot because I was so out of it. So 3 months of chemo, going to the doctor's office, and it didn't work. So my oncologist told me, that only thing that we can do with cancer, it didn't work. It did not work. So I'm sitting there and I'm like, so I'm dead. I'm dead. That's it. I'm going to be dead at 28. Maybe 29, 28, 29. He's like, well, it's not necessary. So the chemo had done a good job. It just didn't finish the job. The tumor was still, it went from, I believe, grapefruit sized to, it started out like this, and then it went down to like this. So it was still sitting on my kidney. So he said, listen, the team of doctors has gotten together, and they said, there's still options. He said, we didn't talk about them, but there's still options. He said, there are doctors. He said there's two places you go if you need a specialist in this field. And they talked a lot about Lance Armstrong and his battle with testicular cancer. He went to Indiana, but some of these, so I could either go to Indiana or Nashville, Tennessee. Now, Indiana is way, way out of my way, so that wasn't an option. It's just financially and physically, there's no way for me to get in Indiana. It's just way, way out of the way. Nashville is pretty far out of the way too, but it was my only choice for staying alive. So I had to make, me and my dad had to pack up and go to Nashville, Tennessee to see a world-renowned doctor that had, he wasn't Neil Armstrong's main doctor, but he had consulted with him, and he actually was part of the team that got the plan, got Lance back and going again. And they actually told me that Lance Armstrong, his brain and lungs were filled with it. And he's fine. He's fine now. So they said, he was a lot worse than my case. So they said, let that give you hope. So we went out to Nashville, and it was spooky because the language from the doctors changed. As they talked about what they were going to do, it's a retroperitoneal lymph node dissection plus, I don't know the terminology, I should know it because I lived it, plus the removal of the kidney is what the retroperitoneal lymph node dissection with the removal of the tumor and the kidney. That was what they were going to do. And me and my dad were like, oh, that sounds pretty easy. And they said, no, this is not a surgery you typically want to have because it's severe, it's major, it's like as bad as it can get. And my dad even made the comment, he's like, it's not like open heart surgery. They said, no, this is worse than open heart surgery. This is a lot worse because this open heart surgery is your heart. They said this retroperitoneal lymph node dissection, that's the part that I've got memorized. He said this involves opening you up, like basically cutting you in half, taking out all the organs out of your abdomen, scraping out, removing all the lymph nodes in your midsection, removing the tumor, possibly removing the kidney, and then putting it all back. So again, we'll go back to the sperm donation. I did, I was wanting to have children if I possibly could, but I declined the sperm donation at first. I was like, we got to get this over with. I gotta get through this. Like, I'm not even worried about having kids right now. So I did start to get worried about having kids at this point because they told me that this surgery, the retroperitoneal lymph node dissection, causes retrograde ejaculation, which would make you not be able to have kids. It could cause you to be completely infertile. It could cause you to become sterile permanently, or it could be temporary, or you might not be able to walk, which means you can't do much of anything else. So it was really scary. They said this is, when you hear a surgeon, one of the best surgeons, and he said, this is as bad as it can be. So that's where I was at. I had to travel hundreds and hundreds of miles for a doctor to tell me this is not a surgery you want to have. It's extremely dangerous. And the way they were talking, we're like, well, it's not gonna kill me. This isn't life-threatening, and they kind of skirted around the fact that it is a really risky surgery, and they said, well, all surgeries are risky, and that when they were kind of skirting around it, they eventually did give me some, like a percentage, like survival rate, and I don't want to give a wrong number. I want to say it was like 60-ish. I mean, I mean, I know that's more than half, but that's not, you don't want to hear that. You want to hear like 110% survival rate. So being told that this is as bad as it gets and this is like the worst surgery you could possibly have is spooky. I was preparing mentally to not be in this world anymore. Did have that, just kind of reminded me, I was doing the online dating thing during this time period. I wasn't dating, obviously, because I was too sick. But I had a girl that was a very nice young lady, and she actually talked to me through all this, and we actually ended up going on a date afterwards. Didn't really click, but shout out to her. She was part of my support system too. Just remembered that. It's crazy. Part of the chemotherapy, which was crazy too, this is how bad the chemotherapy was. Every health problem you could imagine, every body part was affected. Memory was a bad one. At one point, my ex-wife took me to a doctor's appointment, and as we were walking through the hospital, I forgot who I was temporarily. Now, it was just a few seconds where I was walking, and then all of a sudden, I was just a guy walking down a hallway, and I got really scared because I was so sick and in such bad health, and I didn't know why. If you've ever just woken up and you're having all kinds of health problems, that's crazy, crazy scary. Crazy scary. They had to lay me down and just say, hey, chill out. I was like, but I don't know who I am. I don't know where I'm at. I don't know why I feel like I'm like dying. And that was really scary. That was probably one of the worst side effects. Another side effect is extreme memory loss, like I've talked about, kind of in the same vein. At one point, me and my dad were having breakfast, and he asked me how my vision was. And I was like, it's fine. He's like, so it's better? And I'm like, it's my vision's fine with my glasses. It's fine. He said, no, you've been like basically blind for the last few days. You've been running into walls and falling over, tripping over stuff, and you couldn't read, couldn't write. And to this day, 5-6 years later, can't remember any of that. I do not remember any vision loss at all, but I had it. The hair loss I didn't mind because I shaved my head all the time anyway. I was hoping it would grow back thicker. No go there. It does grow back as baby hair, which is kind of cool. And it was nice having no body hair for 6 months. It was pretty cool. The only thing that really got me emotionally with the hair was the eyebrows. You do lose your eyelashes too, which is weird. People don't think about it. Your knuckle hair, your arm hair, your butt hair, every hair. But eyebrow, I ended up with like a half of one eyebrow. So I never got completely bald, but I had one half of an eyebrow. That made me feel bad. That made me kind of look weird. It made me kind of feel like a freak. But, not that big of a deal. You can walk around, you can rock one eyebrow or one half of an eyebrow. So, getting back to it, we scheduled this surgery in Nashville, Tennessee. And we go out there, and so they put me to sleep. And again, I love being put to sleep, except this time I was praying for my soul, praying for my life. I was I was mentally and emotionally preparing to die with my 60% chance of survival or whatever it was. Very, very just no feeling like that in the world. So, put me to sleep, wake up. Surgery went very well. The only thing that didn't go well is they tried to save the kidney. They could not. So, they removed the kidney, they removed the tumor, they removed all of my lymph nodes, and it all went pretty well. It was pretty smooth for such a major surgery. Yeah, it was several hours. I don't know how many hours it was, but it was a long, long surgery. Waking up, I thought the drill in the chest was bad. So I woke up. I'm going to show you. I'm going to say right here. Now, yeah, so it goes from right here all the way down around my belly button and down towards my crotch. It stops right before my crotch. Guys, this is, I don't know, it's my whole, it's basically chest down to crotch. I woke up, and when I first woke up, you're kind of drowsy, you're kind of woozy, you're not aware of what's going on. I have never felt pain like this in my life. There's giant staples going all the way down that. And I had a catheter in. Horrific. Don't get a catheter if you can possibly avoid it. I had drains coming out of the bottom of my stomach. I had to drain to get all the blood and fluids out. Okay, so I'm laying in the hospital bed. I'm like, okay, I'm just going to kick back. Relax. No, they don't let you relax in the hospital. I don't. So they get me up. They're like, you gotta start walking. You gotta get back into. They pull me up out of that hospital bed. I can still feel it 5 years later. I scream so loud. Yeah, I think it took 2 nurses to get me up out of the bed. The most horrible pain I've ever felt in my life. Oh, it was so horrible to walk. I had all these books to read while I was doing all this. Couldn't read because it hurt too bad to hold a book. It was a horrible, horrible recovery. And we had to drive back to Greenville from Nashville after all that, like a 400-mile drive. So I was in the hospital for, I want to say a month, maybe a month, recovering from that. It was excruciating pain. And the catheters, oh my gosh, the catheters for me were excruciating. And I had the issue where they took the catheter out and I wasn't going to the bathroom. So they had to put another one in while I was awake. I have never been a fighting man. I got to tell you, I fought some nurses, male and female. They're like, which one of us do you want to do this? I was like, I don't want any of you to do this ever. I was like, put me to sleep. They would not. Unfortunately, they're not going to put you to sleep to put a catheter in. And man, oh my God. Oh my gosh. Hurts so bad. It's a giant tube. And they just ram it up in there and you can feel it going through your whole body. You can feel it going into your bladder. You feel it. It hurts so bad. Oh gosh, it hurts bad. I was getting laxatives put in the other end of my body. Getting tubes shoved into that. It was extremely painful hospital stay. Extremely. I've never hurt like that in my life. Oh my gosh. So it was really like a month of just torture. Unimaginable torture. The catheter and the like I said, guys, you didn't look at it again. This was, just imagine this, but like fresh. Like completely freshly opened. Oh my gosh. I could barely walk. I could barely feed myself. I was in horrible pain. It probably took, that hurt for years after I got that. Like, I'm still in pain. I'm still in pain from that. Now, I've had some other complications come up that kind of set me back a little bit, but we're not there yet. So, went to Nashville, did this. I thought, okay, I made it through. I made it through. I went through hell. I got a testicle cut off. I did chemotherapy. I mean, just that first thing was horrible. I got a needle in the back. I got a testicle removed. I did 3 months of chemotherapy. I had this huge retroperitoneal lymph node dissection. I lost my kidney, which they told me people think I have to be on a special diet, or they said I might have to do dialysis if my one kidney stops working at some point. It's working. It's not at 100%, but it works pretty good. So I've been blessed with that. So I'm on the way back home finally after a month or longer in the hospital. I get a phone call from the surgeon. Oh my gosh. So he says, everything's great, but, here's the big but. He's like, I'm recommending you do another month of chemo. Oh my gosh. All that. 3-4 months of suffering, horrible, hell on earth suffering, and this guy wants to do another month of chemo. I was like, man, but I already knew I really didn't have a choice. I was like, why? He's like, well, everything looks good. We just want to make sure that this doesn't come back. And I'm like, hey, I'm with you on that. I don't want this to come back either. But man, I thought I was done. Now, the stupid part, and maybe they had their reasons, they wanted me to do chemo in Nashville, Tennessee, when I lived 400 miles away. I said, that's ridiculous. Just let me do chemo in my own town. And I did have some issues with that, with having the surgery in Nashville and living in another state. They wanted me to keep coming out there over and over and over. They wanted to do like 3 or 4 or 5, 6 checkups. And I said, listen, can't I do a checkup in another state? Like, it doesn't have to be the surgeon that did it. And there was a little bit, they kind of gave me a hard time about that. And I said, listen, I can't afford to drive to Nashville over and over and over, like for a 30-second doctor's visit. Finally, they wasted our time by doing one doctor's visit, which was like that. I knew, because that's what doctor's visits are, right? You pay all this money, you wait around and wait around and wait around, and then the doctor talks to you for 5 seconds. And you're like, oh, everything's fine, bye. So we had to do that. We drove all the way to Nashville for one of those. He's like, how you feeling? I hurt. Okay, see you later. And then he finally allowed us to see doctors in our hometown, my hometown. So that was a little frustrating. So I come back and I do one more month of chemo and I'm free. Finally free. Everything looks good. The blood work looks good. My one solo kidney is functioning like 90% capacity, 95. You know, it's good. It's not 100%, but it's good. They never talked to me about a prosthetic testicle, which a lot of people ask about for some reason. A lot of people ask me what happened to the one they got rid of. I don't know. It's in a lab somewhere. A lot of people ask about the kidney, the lymph nodes. It's in a medical lab. I don't know why my friends wanted to see that stuff. I kind of wanted to see it. But, so, I did another month of chemo, which was a lot better. And so everything looked great. And then I started doing CAT scans just to keep track of it. And everything was great. And every time I went, I would just get horrified. I would sit there. I would hear other diagnoses through the wall. People dying of lung cancer, people dying of all kinds of cancers. And then you're waiting on the doctor to come talk to you. But yeah, 5 years of that, of going and getting CAT scan after CAT scan after CAT scan. The the fluids, what do you call it? The fluids that contrast. That stuff makes me really, really sick, and it's cumulative. It also causes cancer, which is ridiculous. But in large doses, I guess. But yeah, for 5 years, I went and got CAT scan, CAT scan, CAT scan, CAT scan. At one point, I kind of got nervous about the other testicle because it did kind of hurt after all that. Went to the ER. I was like, hey, do a scan of my testicle. I was like, I need it now. And they said it's fine. It's probably just scar tissue. So that was a little bit of a scare after all was said and done. I did the 3 weeks to a month of chemo. And I was done. I didn't ring the bell like they wanted me to. The nurses were great. Like I said, just take a lot of books or something to keep you entertained, because you're going to be there between 4 and a gazillion hours. So you might have time to watch like 6 movies. It's ridiculous sometimes. Massages, I really got I got the first foot massage of my life during chemo. I was like, why not? I'm going to be laying here all day anyway. So they massage your hands, they massage your feet, and a lot of like preachers will come and talk to you. So there's some good things going on while you're doing chemo. A lot of positivity up there amongst the negativity. So yeah, I'm coming out towards the end of my successful journey through testicular cancer and the treatment for it. And once I got my appetite back from all of that garbage, I'll never forget the day that my appetite came back. I was driving around and I said, hey, I feel hungry for the first time in a year. So went to Taco Bell, got my usual, a combo plus another item, and I gobbled it down, and I've been eating like a crazy person ever since. I've since talked to my oncologist about it, like, hey, remember when I was a skeleton, like coming in here falling all over your office? Well, now I've gained over 100 pounds, and I can't stop eating. And my oncologist, he said, he had a really good zinger for this. He said, Chris, oncologists are going to be one of the only doctors that don't fuss at you about gaining weight. He said, I like for those numbers to be up. He said, at one point you were malnutritioned and essentially starving to death. And, now you're chunky. He told me his advice, his medical advice was everything in moderation. It didn't help at all. I'm still eating like a crazy person. But, there are worse things. I'm going to get back into shape. I just got to get motivated. My only medical problem since then, which was pretty major, my only major setback has been this, and it was not the cancer coming back. Guess what? I am over 5 years. They said at 5 years, it's not a guarantee, but if you make it 5 years after your last chemo, you're typically safe from it coming back. So I made it to that 5-year mark. I was so excited, so happy. And I started having some pain in my abdomen, like really just bursting sharp pains, and then they would go away. And then really burning sharp pains, and then they would go away. And then those stopped. So I was like, okay, I don't need to go to the doctor. They stopped. But then I got a pain in my other side, not where the cancer was over here, so it was in this side. So I was like, oh no, here we go again. So I got this burning, just this explosive burning in my right side. So I go to the hospital because the pain got crazy. ended up, and I'd forgotten about this due to all the chemo fog and the chemo brain and all that stuff and being just out of it. They had told me, you know, when you have surgery that you can have a possibility of hernias for the rest of your life. It's unfortunate, but it's better than being in a grave. So I'd forgotten about that. But turns out those really bursts of pain were hernias. And I didn't get it checked out. Like I said, I gained a lot of weight. So my belly was sort of hiding the fact, and this big old scar, my stomach was kind of deformed. So it's kind of shaped funny. Even when I'm skinny, it kind of sticks out a little bit. So I thought that everything was normal. Turns out I had a massive hernia on my right side. My intestines were wrapped around my bladder, and some part of it was bleeding. I was bleeding out into my, I think the blood was leaking out of my intestines and going into my bladder. I believe that's what happened. Met up with yet another doctor, and he was kind of grouchy. He said I ruined his weekend. He's like, "What did you do?" Because they rolled me into surgery pretty much almost immediately. I did have to go through some more really horrible medical procedures. I'm sitting there in the ER waiting for somebody to tell me something, and they tell me they're probably going to do surgery, and I'm like, oh man, but that sweet anesthesia. Another medication I like is Dilaudid. That was, throughout all that horror, Dilaudid was the only pain medication that really helped. None of the other stuff, and even the strong stuff, did not help. Didn't help at all. That medication, it would get you so high that you still hurt, but you felt good. You were glad you were hurting. So hydrocodone, no, Dilaudid. Nothing else helped but Dilaudid. Dilaudid made me so high that I didn't care that I was in pain. So that's if you're just like in excruciating pain at the hospital and they've given you morphine, they've given you Lortabs, and it's not touching the pain, Dilaudid. Tell them to pump your butt up with Dilaudid. It was the only thing that cured the ache in my body, like when I was in the worst pain imaginable. So here I am a few years later, and actually about 5 years after the cancer, and I'm dealing with this hernia, which usually isn't that big of a deal, but it became a big deal because I was bleeding out into my bladder. When I woke up, the doctor said that my intestines, bladder, and something else are just all kind of tied up together, and they basically had to open me up again with the same giant incision and fix all of this. So that kind of sidelined me for 2 months or longer. So I'm still, that was about a year ago, and I'm still kind of a little bit sore from all that hernia nonsense, but I'm alive. Thank God I'm alive. And guess what? Here's the absolute miracle out of all of this. So, lost the testicle. Did chemotherapy, which makes you sterile, or can make you sterile. Then I had the retroperitoneal lymph node dissection, which can make you sterile, can give you paralysis, can make you not able to have babies, period. Can cause retrograde ejaculation. And I believe it did affect a lot of that stuff. It affected me pretty greatly. And I was, pretty devastated. I thought, well, the sperm banking didn't work, so probably can't.